Welcome back. This is part 2 of our blood vessel lab review. This is Dr. Jenkins here. In the first video, we introduced simple versus a portal system in terms of circulation routes. And then we jumped right in, and I had encouraged you to memorize these blood vessels step by step because it's so much to do all at once. So please heed my advice. It will only help you. So we began by looking at the blood vessels around the heart. Then we talked about the blood vessels up to the neck and the head. And then we ended off by reviewing the blood vessels to the upper arm, the shoulder, arm, and forearm. Well, now in the second video, we're going to talk about going down. So going down from the heart, or dare I say inferior. And we'll talk about the blood vessels of the gut, and then the blood vessels of the lower extremity. And of course, mixed in there is going to be the hepatic portal system, everybody's favorite. Okay, so let's talk about the arteries of the gut. And I know I was joking around before in the first video when I said that this was Dr. Jenkins's best explanation of blood vessels ever. I really think that the way that I'm going to introduce the blood vessels of the gut, I think this may be the most helpful. Okay, so stick with me. All right, so we're talking about arteries, and we already know that coming off of the heart, nice review, we already know that coming off of the heart, we have the ascending aorta, the aortic arch, we have the descending thoracic aorta, and then running down the abdomen is the descending abdominal aorta. So make sure that you remember those 4 regions of the aorta. Because when we get to the gut, our main guidepost is the descending abdominal aorta. It is huge, folks. We're talking about in a human, because I've done the cadaver dissection 3 times, we're talking about the diameter of a garden hose. So there's so much blood that needs to be delivered to the organs of the abdomen, to the organs of the reproductive systems, and to the lower body. So that's why this descending abdominal aorta is so big. So coming off of that descending abdominal aorta, we have 5 main branches. And that's what I've outlined here for you. And they are in order from superior to inferior. So my recommendation is to simply memorize this list. And then, if you get asked a question about an abdominal artery, then you can just index in your head to, all right, okay, descending abdominal aorta, and there are 5 arterial branches coming off of it. So in order, the highest branch is something called the celiac trunk. It's right here. It's showing you its 3 branches, which we're going to talk about in a minute. But right now, I just want to identify the trunk, which is coming off of the descending abdominal aorta. As we move inferiorly, the next branch coming off the descending abdominal aorta is the superior mesenteric artery. Then we have the renal artery, which of course no one's going to miss the renal because we know that means it goes to the kidneys. So not only can you just memorize these by order, and I'm going to open these up so you can see the picture better. Not only can you memorize them by order, that we have the celiac trunk, we have the superior mesenteric, and we have the renal, but you could also just look to see where it's going. Because where does the renal artery go? Well, it goes to the kidneys. As we move further down, we have the, is it listed on here? Let's see. Yes, we have the gonadal artery, and that's right here. And then the most inferior, as its name suggests, is the inferior mesenteric artery. So if you memorize these are the 5 main arteries coming off of the descending abdominal aorta. In order from superior to inferior would be celiac trunk, superior mesenteric artery, renal artery, gonadal artery, and inferior mesenteric artery. You can also look to see, as I said with the kidneys, we can look to see where they're going. And that's what I've put in parentheses, because I'd like you to also know where these arteries go. The superior mesenteric artery, that little branch right there, is going to supply the intestines. Of course, it's going to have many other branches coming off of it, but the superior mesenteric artery, which is the second branch moving down, coming off the descending abdominal aorta, this is going to supply the small and large intestine. The renal, of course, is going to supply the kidneys. The gonadal, look at where it goes. It heads south, folks. It's going to supply the gonads. So in the males, that would be the testes, and the females, that would be the ovaries. And then the inferior mesenteric is going to supply the distal large intestine with blood. It only supplies the end region, or the distal large intestine. So memorize the branches, and then also make sure you know where they go, what organ or organs they supply with blood. This is good stuff, folks. Because if you look at a different picture, look at this picture, for example. This is another view of the arteries of the gut. I mean, there's so many branches, and there's so many smaller vessels that you don't have to know. I mean, unless you want me to ask you them, because I can. But really, in this course, our goal is just to provide you with the basics. So that's why we're only doing the main blood vessels. So that's why I've stripped it away to these main 5 arteries coming off the descending abdominal aorta. After you memorize that, the next thing would be to memorize the branches coming off of the celiac trunk. That is the highest branch. If we magnify that celiac trunk, we can see it has 3 branches. That's why it's called a trunk, because it eventually leads off into other branches. And memorize these: left gastric, common hepatic, and splenic. Maybe come up with another saying. We have gastric, hepatic, and splenic. Maybe you went to Guilderland High School and it's an easy way to remember. Ha ha ha. And then you can look to see where they're going. And the names, folks, give it away. Gastric means stomach. So where is the left gastric artery going to go? To the stomach. And that's what it shows you here. Here we have the left gastric artery going into the stomach. Where does the common hepatic artery go? That's going to go to the liver. So let's see. Common hepatic is right. This is kind of a weird picture. That's showing you the common hepatic, but eventually it will go to the liver. And then we have the splenic, which of course is going to go to the spleen. So after you've memorized the 5 branches off the descending abdominal aorta, celiac trunk, superior mesenteric, renal, gonadal, and inferior mesenteric artery, then you're going to memorize what organs they supply. And then you're going to go back and memorize the 3 branches coming off the celiac trunk: left gastric, common hepatic, and splenic. And the names themselves should help you to identify where they go or what organs they supply. Again, another view, just to give you an idea of the branches that come off those main branches. You do not need to know all of these. You only need to know the ones that we're talking about. Again, if you like the flowchart view, here we can see those same 5 main branches coming off: celiac trunk, superior mesenteric, renal, gonadal, inferior mesenteric. Now, what about the veins? When it comes to the veins, we only have 3. 1, 2, 3. Now, this time, our vessel running down the center is the inferior vena cava. Of course, the blood flow is going to happen in this direction because it's a vein. And of course, when we put it all together, right alongside the inferior vena cava is the descending abdominal aorta. And you'll see this in the cat dissection videos. The descending abdominal aorta and then the inferior vena cava run side by side. While there were 5 main branches that were arteries coming off of the descending abdominal aorta in the gut, we have 3 venous branches that come off the inferior vena cava. The highest is the hepatic, and that's really high. So if you were doing the dissection in lab with the cats, it's so high up there, almost kind of embedded in the diaphragm almost. It's so high that it's hard to see, but it is still underneath the diaphragm. So it counts as being in the gut. Our second branch down is the renal, goes to the kidneys. And then we have the gonadal, which go to the gonads. So we have hepatic, which goes to the liver. We have the renal, which goes to the kidneys, or drains from the kidneys, I should say. And the gonadal, which drains from the gonads. Boom, 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 1, 2, 3. Now, there is a superior mesenteric vein and an inferior mesenteric vein. So they exist. They just don't come directly off the inferior vena cava. And that's why I'm not asking you to know them in this list. In the arteries, the mesenteric arteries did come right off of the main vessel. In that case, the descending abdominal aorta. But in the veins, even though we have superior and inferior mesenteric veins, they just don't come right off the inferior vena cava. So for now, you don't have to know them. The arteries you do, but not the veins. All right. Now you see this picture, because this is the look that I get when I mention the hepatic portal system. I mean, to be fair, it's a look I get a lot of times when I talk in front of a class, but particularly with the hepatic portal system. But I am here to ease your mind. Don't go anywhere. Stay with me. Okay, we may remember at the beginning of this blood vessel review for lab, we talked about the basic circulatory route. The more times we can review, the better. We said that oxygenated blood leaves the heart through arteries. And then we said that that leads to a capillary bed where oxygen is delivered to the tissues, and carbon dioxide that's built up here comes back into the capillaries. And then we have the veins that bring blood back to the heart. And of course, the veins are carrying deoxygenated blood. You may recall a portal system, similar idea, but we have 2 capillary beds. So instead of the heart just leading to 1 capillary bed, in a portal system, there'd be a capillary bed here. That's number 1 capillary bed. There'd be a portal vessel leading to a 2nd capillary bed. That's capillary bed number 2. And then we would again have the vein going back to the heart, just like we had the arteries feeding here. We only have a portal system 2 places in the body, and one of them is with the liver, and that's why it's called the hepatic portal system. The reason why we have this arrangement is because in the gut, we want the blood that comes from the stomach and the intestines. Think about the intestines. I mean, you eat food, there's bacteria in food, all sorts of stuff. Your body breaks it down, digests it, and then eventually we absorb nutrients through the small intestine wall into the blood vessels of the small intestine, the veins, right? So we have all this blood coming from the stomach and the intestines. Well, we don't want that blood right away to go back into our general circulation. So the idea of this portal system is that we have the first capillary bed because it's collecting blood from the stomach and the intestines, but we transport it to the liver. And that's where we have a second capillary bed. So that blood that has come from the stomach and small intestines through that capillary bed gets shuttled to a second capillary bed in the liver. And that's where we can filter that blood. We can filter out things that we don't want. And eventually, whatever goes back into the venous circulation is clean. So that's why we have the hepatic portal system. How it works. So this is a pretty complex view of the veins of the gut, but let me try and simplify it like I try to do. Imagine we have one capillary bed in green. So we're going to label this capillary bed as capillary bed number 1. And I'm going to change color. How about orange? Then we have a second capillary bed around the liver. This is what makes it a portal system. We have 2 capillary beds. Let's follow the course of blood. Blood is going to be drained from the stomach. Let's see if I can find, before I do that, let me go back, and I apologize. Let me find a different color. I want purple. Ooh. You like that color? I like that color. Okay. All right. Got it. Before I go on, I want to introduce the blood vessel that connects these 2 separate capillary beds. It is the hepatic portal vein. Now remember, we had a hepatic vein. So if I go back, we have a hepatic vein, which is here. And this hepatic vein, I keep changing my mind, I'm sorry. This hepatic vein drains blood from the liver back to the inferior vena cava. That's the hepatic vein. That was our first branch off the inferior vena cava, because it's going to drain blood from the liver back into the inferior vena cava. But separate from that is the hepatic portal vein, and I know they sound similar. If you just hear hepatic vein draining from liver into the inferior vena cava. But if it is the hepatic portal vein, that word portal tells you it is the vein connecting the 2 capillary beds. In this case, it is the vein connecting the 2 capillary beds of the hepatic portal system. All right, so now we're ready to trace blood. So we're going to have blood draining from the intestines. By the way, we can see some of these superior mesenteric and inferior mesenteric branches. So we have blood draining through these smaller veins from the intestines and from the stomach. And all that blood drains through our first capillary bed. But remember, we don't just want that venous blood that is collected from the intestines and the stomach. We don't want it to go directly to the bloodstream. We want to filter it first. So first, the capillary bed number 1 collects blood from the intestines and the stomach. Then the blood from the first capillary bed travels to the second capillary bed through the hepatic portal vein. And then in the liver, that capillary bed, then that blood gets filtered. So the liver can filter out bad stuff that we don't want in our general circulation. Now, whatever is left, I gotta pick a new color here. Let's see if I can use this yellow. Whatever is left is going to return to the inferior vena cava through the hepatic vein. So the hepatic portal vein transported that blood from the first capillary bed to the second capillary bed. And in the second capillary bed, the liver will filter the blood, and whatever is left to stay in the blood leaves the liver via the hepatic vein back up the inferior vena cava and back up to the heart. I mean, I don't want to brag or anything, but that's a pretty simplistic but effective explanation of the hepatic portal system. You should be able to describe this. Okay, hepatic portal. Well, portal means that there's two capillary beds. All right. We got one capillary bed over the first one, over the stomach and the intestines. We got a second capillary bed, and I think I mislabeled that as I'm going through it again. We got a second capillary bed over the liver. The vessel that connects the two capillary beds is the hepatic portal vein. So what happens? Well, blood is drained into the first capillary bed from the stomach and intestines. We don't want it to go straight into the blood yet because we want to filter it. So the blood from the first capillary bed, from the small intestines and large intestines and stomach, is transported to the second capillary bed via the hepatic portal vein. The liver will then filter the blood. Whatever is left and was not filtered out by the blood that's cleansed is able to return to the inferior vena cava via the hepatic vein. A little complicated, but if you have questions, I'm here. I know you can do it. Okay, here's a flow chart if you'd like. Let's move on. So we're almost done, actually. Now we're going to talk about the veins, arteries and veins of the lower body. So we've talked about everything else, the vessels around the heart, the vessels going to the neck and the head. We talked about the vessels of the upper extremity. We talked about the vessels of the gut. And now we're finally getting down to the lower extremity. Much like the arm, once you memorize the arteries, it is almost identical for the veins. So it may seem like a lot at first, but if you take your time, once you learn the arteries, the veins are pretty much the same. So for the arteries, we have to get our bearings so we know we have the descending abdominal aorta. We just talked about the descending abdominal aorta because it travels down the gut. Well, once we get to the pelvis, it simply splits. Up top, it is the descending abdominal aorta. And what does it split into? The common iliac artery, left and right. So this would be the right side. This would be the left side. So this vessel right here, right common iliac artery. Same thing as right here. Right common iliac artery, left common iliac artery. This is going to sound familiar. Coming off of the common iliac artery is an internal iliac artery. It's a little branch that comes internally. However, the vessel that continues after that is called the external iliac. Okay, so coming right off of the descending abdominal aorta, it's called the common iliac. After the internal iliac splits off, that same vessel that continues down is now called the external iliac. It's the same vessel, it's just that before the internal iliac branches off, it's known as the common. After the internal iliac splits off, it becomes the external iliac. If we continue to follow the external iliac, that same vessel Once we get to the thigh area, it becomes the femoral artery. That same artery is going to go behind the knee. Actually, this is a posterior view, so I had my sides wrong. So this is the right side, but a posterior view. And you can see the femoral artery goes deep, shown by these dotted lines. And when it's behind the knee, that same artery that was the femoral, but now it goes behind the knee, that same vessel, when it gets behind the knee, is called the popliteal. Some say popliteal, either way. I say popliteal. Then we follow it down and it splits. We have a posterior tibial artery on the posterior side, and then part of this wraps around to the anterior tibial. And the veins are going to be almost the exact same. So she's memorizing the order. All right, so the descending abdominal aorta comes down the gut. When we get to the pelvis, it splits into a right and left common iliac artery. Then we have a tiny internal iliac artery that splits off internally. After that internal iliac artery splits off, it becomes the external iliac artery that continues, which then becomes the femoral artery in the thigh, which then goes behind the knee and becomes the popliteal artery behind the knee. And then there's a split where part of the artery goes anterior, and that's called the anterior tibial artery. And the other part of the artery goes posterior, and that is called the posterior tibial artery. The veins are almost the same. Yay! Right? Only this time we have the inferior vena cava coming down. And it splits off into a right and left common iliac vein. But then we have an internal branch coming in, just like the artery. That's the internal iliac, and what continues down remains the external iliac. Then it becomes the femoral in the thigh. Then it becomes the popliteal behind the knee. And then it splits into an anterior tibial branch on the front and a posterior tibial vein branch on the back. There is only one additional vein I would like you to know, and that is the great saphenous vein. The great saphenous vein is more medial than the femoral, and it's more superficial. So it's more medial compared to the femoral, and it is more superficial. In the cat videos, you'll see that. The femoral goes deep, remember, because it eventually goes behind the knee. So the femoral continues deep, whereas the great saphenous is a branch that runs more medial, and it is more superficial. All right, everyone, the last part of this lab would be the cat. You're gonna have to watch the video that I posted on Blackboard for you. It's me in the lab with the cat. What they do with the cat is that they drain the blood out, and then they inject this latex solution where the arteries turn red. It's more of a pinkish, but reddish, and the veins turn blue. I do want to point out that there are two differences between the human vessels we've just introduced and the cat. I suggest you memorize these also, because if you get a cat picture, you want to make sure that you don't trip up. The cat only has two branches coming off of its aortic arch. The first and last, brachiocephalic and left subclavian. It, of course, does have a left common carotid artery. It just doesn't come off of the aortic arch. And then last, I don't know the reason for this naming, but it just happens to be, cats do not have a common iliac artery. And the way that I remember that, because even I have a hard time remembering it sometimes, is that cats don't have a CIA, common iliac artery. So if you're looking at the pelvis of the cat, and we have the descending abdominal aorta, and just like the humans, it splits. There is no common iliac artery. So that first branch is the external iliac. Whereas in the human, the first branch off of the descending abdominal aorta was the common carotid artery. Cats don't have it. So if cats don't have the CIA, that first arterial branch coming off the pelvis, coming off in the pelvis, is the external iliac artery. Watch the videos. I'm going to post some review pictures as well. A lot to cover. Review, review, review. Ask questions if you have it. Good job, folks.